The line of defibrillator Saver One consists of 3 handy and versatile models intended both for professional emergency experts and non-professional trained people. Saver One AED, Public Access Defibrillator. Saver One D, Semi-automatic defibrillator with LCD display intended for paramedic personnel. Saver One P, Dual Mode Defibrillator, manual and semi-automatic, a professional one. The Saver One is an AED, a public access semi-automatic external defibrillator. During a sudden cardiac arrest, the cardiac rhythm might be irregular or fibrillating. Thanks to voice instruction and visual and audio signs, the Saver One instructs the rescuer both during the defibrillation and during the cardiopulmonary resuscitation, so allowing to restore the patient's cardiac rhythm in an easy, safe and effective way, even by trained non-professional people. The Saver One allows to restore a cardiac rhythm through defibrillation, which is a duly energized direct current passing through the heart. Thus, a spontaneous cardiac rhythm may appear. The Saver One allows to help anyone regardless of age and weight, adult or child. The rescuer is only to be aware of which kind of patient he is going to help, and if the patient is a child, special adapter and pediatric plates must be used. The defibrillator will automatically switch from adult to child mode, thus adjusting both the discharge and the cardiopulmonary resuscitation phase. The Saver One comes in its traveling bag. Opening the bag, we will find the quick reference guide placed in the front part and illustrating the main steps of the use of the Saver One. Behind the quick reference card in a pocket is the patient's preparation set consisting of scissors, razor, napkin, gloves and disposable mask. The electrodes are in the back pocket of the bag. Spare batteries can be stored in the side pockets. The Saver One uses batteries the operator can easily and quickly change. 2 different kinds of batteries can be used. Disposable batteries lasting 3 years from installation date in standby mode. Rechargeable batteries, which can be recharged using the suitable dedicated charger. The Saver One is an intuitive, easy-to-use device. It has only 2 push buttons, a switch-on button and discharge button, which glows when ready to defibrillate, plus a flashing icon which instructs the operator in connecting the electrodes, and a flashing icon indicating the operator to move away himself and anyone from the patient. Every year in Europe, 700,000 people are affected by sudden cardiac arrest. The cardiac arrest can hit anybody, anywhere, apart from age, sex or state of health. In the event of a cardiac arrest from fibrillation or ventricular tachycardia, every minute reduces the survival chances by 10%. Very few people survive beyond 10 minutes. Thus, the need of using a defibrillator like the Saver One, made to be an indispensable device which allows everybody to save the life of a friend, a colleague, or anybody may need. The ERC recently issued a step-to-step guideline in order to have the maximum chance of success in saving lives. All these steps are called chain of survival. Early recognition of the emergency and activation of the emergency services. Perform CPR, cardiopulmonary resuscitation. Defibrillation. Advanced life support. Assess the patient's consciousness by calling him loudly and giving him a shrug. If he is unconscious, call for help if possible. Then lay him down on his back on a hard flat surface, arms parallel to the body. Then uncover the thorax. Make sure the airway is open. Tilt the head back and listen for breathing. Look at chest movement, if any. Listen to hear any respiratory noises. Lean your cheek to feel if any air is flowing from the victim's mouth. Quick assessment of the pulse rate. Check the carotid pulse. If needed, call the emergency and ask for a defibrillator. First step, the heart massage. Place your hand one on top of the other with your fingers interlocked on the chest bone. Compress the chest for 30 times. Then do 2 mouth-to-mouth respiration. The rescuer keeps the chin of the patient lifted while placing his mouth against the unconscious person's mouth. The other hand pinching the nostrils shut and keeping the head tilted. Then exhales for about 1 second. These steps to be repeated 5 times. Shave patient's thorax. Open the electrode packet. Switch on the Saver One. A beep will confirm it's switched on. Follow voice instructions.
Place electrode pads.
Place electrodes on the chest as shown on the pictures on the pads. Plugged connectors. The defibrillator will now start work, informing the operator by voice messages.
Don't touch patient. Rhythm analysis. Shock advised. Charging. Press green flashing button.
The operator has 15 seconds time to press the discharge button.
Shock delivered. Begin CPR now. Press patient's chest down fast. Give 2 breaths. Inflate. Inflate.
The defibrillator will assist the rescuer throughout the CPR. Then it will analyze again the ECG of the patient to check his state. Go on with the CPR until professional rescuers arrive.